Welcome to Chiropractic Science, where you get to hear interviews with leading chiropractic researchers from around the world. Hear about chiropractic research from the authors in plain English, not through the media, nor a middleman. My name is Dr. Dean Smith, and I am the host of Chiropractic Science. I'm an associate clinical professor in the Department of Kinesiology and Health at Miami University, and I'm also a chiropractor in Eaton, Ohio. My research interests relate to understanding how chiropractic affects motor control and human performance. Today, I have the privilege of interviewing Dr. Kevin Haussler. But before we get to the interview, I wanted to thank all of you who have subscribed to Chiropractic Science, and I'm especially appreciative to all of you who have contributed 5-star reviews on iTunes. iTunes really helps others find out about chiropractic science. So, if you like the show, please take a second and write a review. It will support chiropractors everywhere. Dr. Rich Manley wrote a review and says, "Excellent podcast. Thanks, Dr. Dean, for continually providing informative and interesting content with lots of doctors doing important research. You're doing the chiropractic profession a great service." Well, thank you, Dr. Manley, for your feedback and review, and I look forward to sharing your iTunes review in a future podcast. Well, it's now the new year, and the 2020 update of the Chiropractic Science slides presentation is available to educate your patients and your community about the benefits of chiropractic care. The slides are currently on sale, but as a bonus for listeners of this podcast, you can take an extra $25 off by entering the code PODCAST25 at checkout. There are now over 365 slides in the presentation. Each slide includes a short evidence-based message from the scientific literature, along with the reference and a picture. In addition, you can customize the slides to your clinic. For more information and for slide reviews, check out our website at chiropracticscience.com. All right, on to the podcast. Well, let's get on to the interview with Dr. Kevin Haussler. Dr. Haussler graduated from the Ohio State University College of Veterinary Medicine in 1988 and completed a small animal internship in Sacramento, California. To further his training in the conservative management of spinal-related disorders, he pursued human training at Palmer College of Chiropractic West and completed a veterinary chiropractic certification program in 1993. He attended the University of California, Davis to attain a PhD, focusing on spinal pathology and pelvic biomechanics in thoroughbred racehorses. Postdoctorate training involved evaluation of in vivo spinal kinematics in horses at Cornell University. While at Cornell, he directed the newly formed Integrated Medicine Service, which provided chiropractic, acupuncture, and physical therapy services to both small and large animals. Currently, he is an associate professor at the Orthopedic Research Center at Colorado State University and is involved in teaching, clinical duties, and research into the objective assessment of musculoskeletal pain, spinal dysfunction, and the application of physical therapy and rehabilitation. Dr. Haussler is a charter member of the American College of Veterinary Sports Medicine and Rehabilitation and is currently a course instructor for the Equine Rehabilitation Certification course co-branded by the University of Tennessee and Colorado State University. Dr. Haussler, thanks so much for coming on the Chiropractic Science podcast.
Well, thank you very much, Dr. Smith. I appreciate the offer to be able to come and join and share some information with you today.
Oh, that's great. And I've wanted to have you on for so long, and I've got a lot of questions. We'll try to get through as many as we can.
Okay.
But first, I always like to ask my guests if we can start by telling how you became interested in your case, first becoming a veterinarian and then becoming a chiropractor.
Okay. Yeah. Well, I guess I've always had an interest in helping animals and just going through high school, trying to develop where I was going to do, with my career. I found out that I really was interested in veterinary medicine. And fortunately, with a lot of hard work and dedication, I was able to successfully complete that education. From there, I got into a small animal internship program. And through that training, I learned that I didn't want to do general practice for the rest of my life, but really wanted to specialize in the area in veterinary medicine. And then just from my personal experiences, in high school with athletic competition, I was exposed to human chiropractic and was impressed with its ability to help diagnose and treat, subtle muscle weaknesses or performance issues that I had. And then had also been exposed to veterinary acupuncture and some of the diagnostic or unique treatment capabilities that had extended beyond the typical medical approaches of using, medications or surgery to help address injuries or diseases in animals. So after that, then I explored a 4-year human educational program, looking at human acupuncture, chiropractic school, physical therapy school, and try to figure out which one of those best fit my needs. And after a little bit of investigation, talking to some people in the field, decided to pursue the human chiropractic training as kind of my first step in looking at further education. I kind of consider it my residency training program.
Well, that's terrific. So you were in practice for a little while then as a general vet, and then you pursued chiropractic training after that?
Yeah, I was in a small animal internship. So that's where we just did general medicine and surgery. So that was all private practice. Also, during my human chiropractic training, just to help pay the bills and pay for tuition, I did lots of relief work where I worked at small animal veterinary clinics or emergency clinics doing overnight duty, or worked at the local humane society doing spay and neuter type things. So yeah, I had quite a bit of experience as far as diagnosis and treatment, from the veterinary perspective, but I was looking for other tools to put in my tool bag, and chiropractic seemed to be the best one for me to add.
Well, that's fantastic and really fascinating stuff. So from there, after you got your chiropractic degree, what was it that led you to want to pursue a PhD?
Well, as I was always interested going through the human chiropractic education, I was always interested in the research to really understand how chiropractic worked or how it integrated with other types of modalities. And so I was always kind of hungry for knowledge from doing that. And once I graduated and got out of chiropractic school, I started to do private practice where I worked on animals, dogs and cats, mostly horses, to do that. But unfortunately, or fortunately, I guess, I was challenged about, how is it possible to treat a horse, that big of a size and have any meaningful effects? Chiropractic in animals was not very well accepted at that time. And so I was, searching again for more knowledge or information to help me become a better practitioner. And so I was challenged about, where's the research to do that? And so from there, then I looked into a couple different programs and was fortunately able to find a program at UC Davis and be able to look into doing some research in that area. I guess the frustrating thing was, or maybe the naivety of me was, is that when I started that PhD program, I wanted to prove that chiropractic worked in horses, and that's a pretty tall order to do that. And my advisor at that time, she just wisely asked me, basic questions like, what do you know about the equine back? And I said, I don't know much at all about it, other than what I read in anatomy books or, limited textbooks or journal articles on back pain diagnosis or treatment at that time. So didn't really know much. So I really had to kind of go back to the basics and studied spinal anatomy in the horses, joints and the muscles that were involved with that, some of the biomechanics, and then the pathology. So it was part of my PhD training from that. And from there, I really understood a lot more about kind of the workings of the back, but I still hadn't made any progress at all about exploring how chiropractic really worked in horses as far as trying to treat pain or stiffness or issues with poor performance. So from there, I was able to fortunately go on and pursue postdoctorate training at Cornell, and where I was able to really begin some work as far as understanding equine spinal biomechanics. We really did explore some of the mechanical effects of chiropractic care and some of the nociceptive or pain effects of chiropractic care in horses, and objectively measure those things. And so from there, we were also, as you said earlier in the introduction, able to do the integrative medicine service, offering those clinical services to animals and help out with that. And so kind of a combination of applying the clinical work and the research work together was, very useful in my program or my development at that time.
That's terrific. And I really want to just piggyback on one of the things you said, which was, you mentioned that you wanted to prove chiropractic in in horses and the effectiveness and whatnot. And I think a lot of us get into research because we have similar aims, and then we get the realization of, wow, there's a lot that goes into this.
Yeah. It's more of a lifelong career rather than just a 3 or 4 PhD, 3 or 4 year PhD event. So yeah, again, kind of my naivety with that. So
well, all of ours.
Yeah, interesting thing about research is that you go in and try to answer 1 or 2 questions, and you wind up that you got about 10 or 20 more questions on the back end of it, and so it's a perpetual thing to keep you busy that way.
Perfect. Yeah. So Kevin, you're a research leader in veterinary chiropractic care, particularly for horses, as you mentioned, and you've been published in top journals such as PLOS One, Veterinary Surgery, Veterinary Clinics of North America, Veterinary Journal, and the Journal of Orthopedic Research, just to name a few of them. In order to get through some of your expertise, I figured we could talk about 4 main themes. One being how chiropractic techniques can be applied to horses. 2, how do we know, or how do you know, how does anybody know, I guess, how we're making a difference? And effects of mobilization versus manipulation in horses. And finally, we can talk about some controlled clinical trials in horses with back pain, acute versus chronic back pain. So let's get started with the theme 1. And I think this will actually get through quite a few comments and questions that I initially had for you when I was thinking about you as coming on and being a guest. And that would be, well, how chiropractic techniques can be applied to horses. Could you give us an overview of this theme, perhaps, and summarize some of the different ways chiropractic could be applied to horses?
Yeah, well, I guess I would like to kind of start out with a little bit of definition. And my perception is that some practitioners have a pretty narrow view of what chiropractic is and what it has to offer. There's kind of the straight versus the mixer argument, which has been going on for over a century and hasn't really helped us move too far forward as far as the profession. And I guess my perception, or what I've learned, is that chiropractic is really kind of one aspect of the umbrella of what I consider manual therapies. And that includes a broad spectrum of different types of therapies we use with our hands as far as for diagnosis and treatment purposes. So on one end of that spectrum would be more touch therapies where there's little or no hand contact with the patient, to the other end of where I would describe chiropractic as far as where we're applying high velocity, low amplitude thrusts to move deep articular tissues to induce some sort of therapeutic effect with that. Then in between those extremes are massage therapy, stretching, passive stretching, soft tissue mobilization, and joint mobilization. And I think as far as, all of these type of therapies, none of these have been developed primarily in animals or in horses. They've all been developed in humans. And from there, the people have, reported, well, massage feels good for me. What would it feel good for my dog or my cat or my horse? And so these things have been borrowed and brought over into the veterinary profession because of that. And I think that we need to kind of be a little bit critical anytime when we talk about translational medicine, using things that have been shown to be effective in people and then saying, well, those are effective in horses, or, the flip side is, well, this drug or whatever works in mice, therefore it's effective in humans. And I think we always need to be a little bit critical about that. So I think those are some of the things that we need to think about from a chiropractic perspective. I think the other controversy or comment or challenge that I was always presented with is, well, how in the world can 110-pound little human chiropractor treat this 1,500 or 2,000-pound horse? And there's obviously a challenge with just the physicality of doing that. And so we had to do a little bit of research to understand, can we really move a horse's back? And we'll talk a little bit about that as we go on here. But yes, we can do that as long as you get your patient to relax for you and you're only treating 1 or 2 vertebral segments at a time versus the whole patient. So I think that those are things that we need to think about. I guess the other thing, that I was a little surprised about going through my chiropractic, just on my chiropractic education, just kind of on retrospective reflection here, is that I was going through chiropractic school, really only taught high velocity, low amplitude thrusts, and kind of said, well, these are the best or the most effective for treating neck or back or pelvic pain or whatever that. And there was really little regard given to soft tissue mobilization or maybe some of the other things like stretching or things like that. And I understand that being from a chiropractic school, but really kind of looking more for a global perspective as far as how we can help our patients. And fortunately, I have been able to work with some pretty amazing equine massage therapists or Feldenkrais practitioners or other people using Alexander techniques, which focus a little bit more on body movement patterns and things like that. So it really did open my mind to a wide variety and of the different, very diverse methods that are out there to address kind of more neuromuscular articular disorders in both human and veterinary patients. So a long answer to your question, and I guess I just have a very broad, open perspective as far as what chiropractic is and what it has to offer to animals in general.
That's great. I really appreciate the longer answer, actually, because it really helps, I think, to understand the nuts and bolts of where you're coming from and the different types of care that a horse might receive if they get care from a chiropractor or from a vet also that does hands-on type of work, whether it be massage or whether it be chiropractic type of techniques. So I want to go a little bit further on that because, I've got a lot of friends who take their horses to chiropractors or to vets with specialization doing these types of techniques. And I hear different things from almost everyone about how the horse is treated. And of course, you could say the same thing for human chiropractors as well. Some use instruments, some use their hands. I'm just curious what your take is on, sometimes I see little mallets being used or larger mallets, activators, hands-on. Can they all work? And what's the research at this point showing us about some of these different tools?
Yeah. Well, I guess as far as the short answer is yes, they all do work. I guess it just depends on what your definition of work is as far as being effective. But from human research saying activators are effective for producing clinical responses using your hands or that way. Other mechanical devices, you can do those type of things. And so we have explored some of that. We have one project that we used the activator to treat the horses, and we seem to have similar clinical effects as far as using our hands. My preference is always to use my hands because that gives me more of a direct connection to the patient. But there are some horses or some dogs that do respond better to the activator, or I can't touch them and I need to get a little bit more of that proprioceptive or nociceptive stimulation to kind of quiet their nervous system before I can go ahead and maybe do a little bit of mobilization that way too. So again, I like to have lots of tools in my tool bag and pull whichever one out works for that individual patient. And sometimes that's an activator and sometimes it's stretching. Sometimes it's acupuncture or laser therapy or sometimes or oftentimes in my case, it's chiropractic combined with some of those other things.
Oh, that's great. And very, very good. Very good. So you said that you have a preference for your hands. What research has been done on horses? Have they used primarily hands, or you mentioned one study where you compared mechanical instrument versus hands. Have most of the studies been done using hands, or?
Yeah, I think that's probably more of the high velocity, low amplitude thrusts is what we're talking about, more the chiropractic or the spinal manipulation type of forces that we're doing with that. And so the literature that's out there, those are mostly what's been described. I know that there are a few practitioners coming out of Europe using McTimoney techniques, and I always try to stay away from kind of brand name things because it really doesn't help me understand really what it is as far as, technique driven names to do that. So again, I kind of fall back on, is this more of a soft tissue mobilization technique? Is it more of a joint mobilization technique? Or are we talking more about a high velocity, low amplitude type of technique? And those things I can understand and wrap my brain around a little bit that way better.
Yeah, it makes sense. So before we discuss some of the other articles, I do want to ask you about what kind of training does a veterinarian or a chiropractor need in order to do animal chiropractic?
Yeah, well, there are currently about 5 or 6 postgraduate training or certification programs in the U.S. right now that provide education for veterinary chiropractic techniques. All of these courses offer a combination of didactic, lecture-based learning, and then also practical or hands-on training in chiropractic techniques, and they're mostly focused on dogs and horses to do that. And so I've been teaching or contributing to a course over in the Netherlands for about the last 20 years to do that. And I've been impressed with a lot of the manual therapists that are coming from the human side as far as having some of those techniques and skills. Sometimes it's challenging to really teach veterinarians how to palpate or do more of the spinal evaluation. And I guess I can just rely back on or reflect back on my experience going into human chiropractic school is, I was what I called myself a successful small animal practitioner where I could really feel thickened bowel in dogs or cats or, feel little lumps or bumps on their skin. So I felt like I really had a good psychomotor or palpatory skills with that. But I just remember the first year of chiropractic school going through labs, they would, have us doing motion palpation or mobilization, and the lecturer, the instructors would say, well, do you feel this? Do you feel this? And I'm standing there, no, I don't feel this. And so it took me about a good 6 or 9 months before I could tell the difference between a mild stiffness versus a severe stiffness. And it was a pretty humbling experience that way too. So no, I think that there's educational programs out there. Most of these are probably around 200-hour courses, which is a far cry from the 8,000 hours or so that you put into a 4-year training program, going through veterinary school or chiropractic school. So obviously it's a brief introduction to that. And so people obviously need to, if that's something that a tool that they want in their tool bag, then obviously they need to learn how to use that tool and keep practicing or get further education with that. But the certification programs are out there, and that's probably the best mechanism right now for people that are interested to get involved with that.
Okay, great. Thank you. And any tips on where to find a good referral for animal chiropractor or a veterinary chiropractor?
Yeah, well, that's always a good question. I haven't been able to come up with any good tips for that, unfortunately, just because there's such a wide variety, as you mentioned in your introduction, as far as different practitioners' approaches, the different tools they use, their treatment protocols that they come up with. The only thing that I can really recommend is to get a consult with somebody that you're interested in seeing and seeing if they really are good with animals or not. If they're a good horse person or a good dog handler, then that's always the first step, because you don't want to go someplace where your dog is going to bite somebody or your horse is going to be kicked or hurt somehow because they're being mishandled or not handled well and they get away from the person. If the practitioner can meet that basic requirement and you feel comfortable with them handling your pet or your horse, then I would ask them if they, what their treatment approach is for what do they see mostly. Do they mostly see geriatric dogs, or they mostly see performance, hunter jumper horses, something like that, and ask them what their success is with that. And then I would go ahead and just have them evaluate my horse or my dog to do that, and watch them and see how they approach things to do that. And I guess my general rule of thumb is, if it looks like something that you would like done to yourself, then I would say it's probably safe or okay for them to go ahead and treat your pet or to treat your horse. But unfortunately, that's about the best recommendation that I can provide, because there is quite a bit of variability out there in people's skills and knowledge base.
Yeah, very good. Very good. Well, let's transition to theme 2. And this theme is talking about, how do you know you're making a difference? And so here we can talk about some objective outcome measures. And I'd like for you to give us some ideas of how you might know you're making a difference with a horse, especially since obviously they can't verbalize their pain or experiences. And I think in the past, we've both found it difficult to elicit these things from humans. So perhaps in horses, it adds an even extra component to that. Yeah.
Well, I would say it adds an extra component, but if you're skilled to that, I think that it makes your life a lot easier too, because I think animals are really truest in their perceptions of you and your applied treatments. Humans carry a lot of baggage with them, either socioeconomic or ergonomic challenges, carrying your billfold around your pocket or sitting at a computer all day, or emotional baggage with that. And oftentimes that kind of gets in the way of you assessing or providing a clear diagnosis or applying effective treatment with that. And animals in general have a limited bias or placebo effects with that. So if you are making a difference, they're going to tell you that, or they're going to show you that. And if you're not, or if you're hurting them, then they're going to be pretty clear, either by getting bit or kicked with that too. So I think with that, you just have to balance those things with that. I think the challenge with some of our nonverbal patients is that we need to come up with other ways to assess our treatment efficacy. And that was my biggest challenge when I was, confronted with, well, how do you know you're making a difference here? And it's like, well, I think that they're moving better, or it seems like they're in less pain, or seems like they're, bending better. But unless you really try to put a number on that, it's, kind of a guess. And so I guess that was my biggest first challenge, was to really kind of put objective measures. How do we really measure pain in animals, or how do we measure stiffness? And so that's really been kind of a primary area of my research interest, is to really kind of subjectively or objectively measure things that we see in our chiropractic patients. And so the first area that we did was looking at pressure algometry to really assess mechanical nociceptive thresholds or pain thresholds in the horses. And we needed to develop baseline or standard values, because if you don't know what the normal is, then how do you know if the horse is painful or not painful, or got better to your treatment? So did some of that work, and then also looked at some horses where we actually put little surgical pins, bone pins into their back for another study measuring some spinal kinematics. And we could see that there was pain there, and our pressure algometry was able to clearly diagnose that. So it's sensitive as far as being able to predict things there. And then from that, then we could say, well, let's do some chiropractic treatment or other types of therapies, and say, can we really change or reduce pain? So that was our first thing that we looked at. The next thing that we look at, or clinically what I see a lot of stiff horses. And so, well, how do you measure stiffness? From humans, we can do goniometers, put them on their head and do neck bending, or we can ask them to reach down and touch their toes. Horses, being quadrupeds, have some limitations with that, but we can sure do neck flexibility and measure how far their nose is from their elbow, or from their stifle, or from their knee in their back limb. And so can measure some things that way. My interest was mostly looking at back stiffness, and so mostly just dorsal ventral motion or flexion extension type of movements to do that. That was one thing. Other researchers have looked at EMG to measure muscle activity before and after treatments. Currently, there's a movement to look at a lot more at inertial sensors. Those things are measuring more overall body movement, or activity monitors. Those are easy things to do. And so if you see a horse is moving a certain way before your treatment, and afterwards he's doing more, or before he's taken 5,000 steps and after your treatment he's taken 10,000 steps, then that gives you some numbers as far as doing things like that. Other kind of simple things that we've looked at is visual analog scales, just owner's perception of, well, how was your horse today on a scale from 0 to 10? We've also developed some kind of functional questionnaires as far as how the horse is able to bend, or use some spinal reflexes to move, or have kind of more assessment of kind of core stability, or use goniometers to measure range of motion, or flexible tape measures to measure like limb circumference as far as muscle development, things like that. So we've really interested in a lot of different tools to really apply to our chiropractic patients to see, are we making a difference here or not?
Yeah, that's really fascinating. One of the things I was just thinking about with pressure algometry, for some people that may not know exactly what that is, can you describe how you went about doing that in the horses?
Yeah. Pressure algometry is just a little pressure gauge where you push on something and it measures the amount of force that you're applying to that. And so it's been used in humans. You push on a tender point or a point where there's painful, and you push down until the person says ouch, and then you stop and you look at the number that says on the gauge. So it gives you an objective evaluation of that. And so it's helped me because Some people may say, well, the horse has back pain, and then the next specialist standing beside them says, well, no, the horse doesn't have back pain. It's like, well, which one of these people do you believe? And if we can put a number on it and both of them come up with about a 10, then we say, yeah, okay, this is below a threshold of normal horses. And yeah, this horse has back pain. So those are the challenges with that. And so we've gone through and measured horses from their nose all the way back to their tail and got standard values with that. We've looked at horses that are older horses versus younger horses, geldings versus mares as far as sex differences. We've looked at different breeds because that's always one of the things. Well, my horse is thin-skinned, like some of the Arabians might be more sensitive versus some of the draft horses might be thicker skinned or more stoic. And so we really can evaluate within that individual patient what their baseline is and compare one spot where we would say like it's a control group or control spot up over their withers. And then if they really do have like sacroiliac pain, then we can compare those two sites within that horse and say in general, this is probably a more stoic horse, but he for sure has or she has more pain that she shows in different areas. So I find it a useful tool. Sometimes it's a steep learning curve for some people to do that as far as how much force you apply and how fast you apply that and things like that. But in my hands, I found it to be a very useful tool clinically and also from the research perspective.
All right. Yeah, very good. And so there was another paper that you published on the effects of chiropractic massage and phenylbutazone on spinal mechanical nociceptive thresholds. And so for our listeners, can you describe briefly what that study was about and what you found?
Yeah, well, I guess, again, the challenge with a lot of research or even, the human research is that there's not well-controlled groups in those. It's like, how do you do a sham or a fake chiropractic treatment? And so with the horses, again, since they have little placebo effect, they don't know if they're really getting chiropractic care or if you're just giving them a massage with that. So that's really what we wanted to evaluate was some of the kind of the common modalities that are out there using chiropractic, using massage therapy, and then phenylbutazone, which is a common non-steroidal that we use in horses for inflammation and pain management. Those are typical things that we would treat a horse with back pain, acute back pain, to help that out. And then we had two different control groups in this study. One control group was that the horse were active in exercise, just like the other treatment group horses. And then the inactive group was a group of horses that were brood mares or horses that were out of training. So we had an active and inactive control group with that. They didn't get any treatment during the 7 days that we did the trial there. So just to evaluate different therapies and kind of where chiropractic fell in that spectrum. Is chiropractic more effective than non-steroidals or less effective? Because those are important recommendations for us. If we're have a horse with back pain, we need to say, well, let's give it phenylbutazone because this is going to be 50% better than doing chiropractic, or vice versa. Chiropractic might be more effective than using massage therapy, and those are things that we needed to understand or questions we had that we wanted to ask with this study.
Okay, great. And so, what were the conclusions? What did you find in that study?
Yeah, well, interesting. From the chiropractic's perspective, in that group of horses that we treated, that group of horses, we evaluated them on 1, 3, and 7 days after treatment from a baseline. And 1 day afterwards, the chiropractic horses actually got more painful. And then finally on the 3rd day and the 7th day, they showed the biggest increase as far as feeling better or reduced back pain with that. So kind of a take-home message is if you're treating horses, don't call the owner the day after you treat them. Wait a week and then call them, because then that's really going to show you to be a better practitioner, have better effects with that. The other part, as far as from the massage group actually got better right away, day 1, and they continued out to day 7, but they didn't improve as much as the chiropractic group on day 7. The phenylbutazone and non-steroidal, interestingly, actually got worse or more painful for the first day after treatment. And we didn't really see a positive effect of that until like a week later, which is really the opposite of what we would expect. Normally, if you take a non-steroidal or Advil or something like that for your pain, you would expect within 6 to 24 hours that you would feel better with that. And these horses actually got worse based on our measurements in this study here. So don't have a really good explanation why that happened. To do that, I've talked to several people, and there may, anti-inflammatory, this type of anti-inflammatory has both local and spinal cord effects. And so maybe there was some delayed onset about some of the neural changes or modifications in nociception within the spinal cord that took a little bit longer to kick in. But other than that, I really can't answer that. But then in the two control groups that didn't get any treatment there, they had basically zero change over the week period of time there. So it gave us good confidence that the chiropractic, those horses didn't get better just because those horses were enrolled in the study, or they got better just because of time being handled or whatever that way, because the other horses that had the active and inactive control groups, they were handled similarly to that. So helped give us evidence that chiropractic was the more effective treatment there over the long period of time to do that. As with any research, then the interesting question would be well, what if we did massage and chiropractic together? And then, to hopefully blunt that negative effect from the chiropractic group one day afterwards, and to rely more on the massage effects helping out with that. And then maybe we'll get a synergistic effect and we can get a better treatment, a week to 2 weeks down the line. And then that would be the other study, would be to do longer term studies rather than just a week, do it, for a month or 2 months down the line and see if we can make a difference that way.
Yeah, perfect. And we'll talk about one of those studies coming up that you coupled laser therapy with hands-on chiropractic care. So before we leave this theme, though, I do want to ask you, as I was reading through this paper, something really caught my interest, and that was that the effect of chiropractic and massage seemed to be greater for parts of the spine that were closer to the tail. Any ideas why that would be?
Yeah, I don't know for sure about that either. Just from our normal baseline nociceptive levels, their horses are most sensitive around their head and their neck, which normally we would see that with people too, around your face and your neck. Then they have higher thresholds, less painful through their trunk region, which is probably good for us if we're riding the horses, that they're less painful there normally. And then back toward their pelvis and their lumbar region, they have the highest levels in normal baseline values in that area. Some people come up with a theory of, and those are the same patterns we see in people too. We have higher nociceptive thresholds in our butt, in our pelvis area, maybe why we can sit all day or sit for long periods of time without getting pain there versus, if we sit on our head or neck, then we would get pain much sooner than that. So I don't know for sure about that, but some people would say, well, there's longer nerve fibers that go from the lower back up to the head. And it's like, well, I really don't understand how that would change your nociceptive thresholds to do that if we're talking about milliseconds of changes that way. So the only thing that I can really come up with would be more kind of from a evolutionary perspective, and this is just my speculation. I have no evidence to support this, but when you watch animals, horses or prey animals, being attacked by a predator, the predator oftentimes goes for their head and neck. And when you see that happen, those animals become paralyzed or succumb to that attack. And so versus if they get attacked more from their hind end, from their pelvis or things like that, then they can sometimes run away or kick out or things there. And so I don't know if it's a evolutionary or developmental thing where they have more pain resistance in their hind end to help with them to protect themselves as they're running away versus if they got caught by their head and neck. I don't know that, but I'm just kind of making things up as I understand them that way. But to me, that makes a little bit more sense than saying, well, the nerve fibers are, 3 feet longer here, and therefore that changes the pain sensation. I have a hard time understanding that.
Yeah. Oh, that's really interesting. Just even considering some of those possibilities. So thanks for going through that. So
Sure.
next up, if we could go through, you've done some research on the effects of mobilization versus manipulation, and you described those very well as we went through the introduction. So I wonder, there was a paper that you published in the American Journal of Veterinary Research in 2007. I wonder if you could go through this study that you did, and you looked at mobilization and manipulation on the kinematics or the movement of the thoracolumbar region.
Yeah. Yeah. Well, I guess that's always been my question. Again, from the prior study, we're saying, well, is massage different than chiropractic? And in that one study, we showed that there was a difference with that. And just talking with physical therapists, or just doing spinal mobilization myself, is sometimes just doing your motion palpation or your diagnostic perspective with that. The horses seem to get better with that. Or as I'm teaching some of the chiropractic courses, we have students repetitively, for 3 or 4 hours, sometimes mobilizing this horse. And this horse was pretty painful in the morning, but after getting mobilized for 3 or 4 hours, the horse is less painful or less stiff in the afternoon. So it's like, wow, is mobilization having an effect here too? Just from that, it's not only giving us diagnostic value, but it's also giving us therapeutic value. So we really wanted to understand, how is just doing spinal mobilization different from doing high velocity, low amplitude thrusts? And from prior work to do that, we had an evaluation of chiropractic treatment in natural occurring back pain and some of the induced pain from what we did from the spinal pins going into their back. And so in this study, we also wanted to evaluate that more of an acute pain setting, which may be more representative of humans with acute onset back pain rather than natural occurring back pain, which we did in the prior study with the chiropractic and the massage. So here, what we wanted to do was to look at our effect of mobilization in the painful sites that had the spinous process pins put in and then taken out. So we followed these horses after that procedure. And then we also wanted to look at non-pain sites that were in front and behind those type of things, or in front of those sites, to see if there were differences there. Because looking through the human literature, it tends to suggest that mobilization might be more indicated in more acute settings versus chiropractic might be more effective in more chronic pain situations. So that was kind of another aspect or perspective we want to look for this study here. So from this study, we looked at stiffness, how the horse was able to move, dorsal ventral mobility or flexion extension mobility. We wanted to measure how much force we were applied, because obviously if we're mobilizing with 10 pounds of force versus 30 or 40 pounds of force, then we're going to be able to move the horses back more. And then there might be some sort of maybe treatment effect with that, or a dosage effect if I did a small force versus a high force to do that. But then we wanted to look at the amount of motion that those horses moved at those pain and non-pain sites. Again, thinking that, well, if you have pain in one site, then you're going to have more muscle guarding or more nociceptive responses, so you're not going to be able to put much force there. And the horse will respond or step away from that treatment area. So we applied chiropractic treatment in one group of horses, and then the control group, we just did spinal mobilization, and we measured those before and after treatments. And then a week later, we gave them a washout period, and then we flipped those two groups, and then we did the treatment and the control groups in the opposite group of horses, more of in a crossover study design to use their own horses as their controls to provide a little bit more statistical power for that. And what we found with that was the spinal mobilization really in this horse model was ineffective, which was kind of opposite of what we found. But the manipulation, we did the chiropractic treatment, really did increase spinal mobility about 15% and really allowed us to apply more force to the horse's back, which mean they were less painful, which may not have a lot of clinical relevance unless you think about treating a horse before where they were bucking and they couldn't have the owner on the horse's back. And then after the treatment, they could apply more force or weight of the rider, and then those horses weren't bucking or kicking after the treatment, which I've seen clinically to do that. So does make sense from the ability to increase flexibility and ability to apply more force to the horse's back. Those are things we do see clinically.
Well, that's terrific. So based upon this research, then you were talking about, coupling various therapies together, like perhaps mobilization and manipulation. Here you did them separately, but I wonder if you hypothesize going forward, if you did both, maybe you do manipulation and then do some mobilization, or do them at the same time, as you said, maybe we get a bigger effect, but that's something that we haven't done yet, or we don't have the knowledge of?
Actually, we have done that work in another study here that I didn't share with you. We actually did similar work with that. These were in horses that were in active performance, polo horses, so they were in active performance, so they didn't have any acute back pain other than normal kind of soreness that they had with their performance or ridden activity that they were doing. We did this, followed them over 3 weeks period of time rather than just the 2 weeks that we did earlier with that. And what we found, we did, again, a control group where we just did the mobilization, and then we did the chiropractic right after that. And then we followed these horses for 3 weeks. And what we found was that the spinal manipulation, the chiropractic treatment, had immediate effects. We increased their spinal mobility about 20%, and the amount of force that we could apply to the horse's back about 20% too. However, what we found was that the spinal mobilization had delayed effects. So from week 1 to week 2, the horses that got spinal mobilization actually had more flexibility during that period of time. So it really does help us understand that spinal manipulation has immediate effects, but the spinal mobilization has delayed effects. And so to me, that's an interesting thing, more from a mechanistic perspective of, well, how do really manual therapies work? And so there must be different mechanisms, neurologic mechanisms or biomechanical mechanisms, different between spinal mobilization and manipulation. In this study, both of them were effective. The manipulation just was effective immediately within 10 minutes, and mobilization was effective over time within 5 days or 7 days. So interesting things to think about.
Yeah, those are really interesting comparisons. So how do these forces compare with humans?
Yeah, well, that's another thing, kind of, saying, well, can we really move a horse's back? And it's like, okay, yeah, we can move it. But then are those force displacement profiles similar to what's been reported in humans as far as with the high velocity, low amplitude thrusts or with the spinal mobilization? And so we've measured some of those profiles with that. Our peak forces occur over a few hundred milliseconds related to speed, and that's the same type of force profile that we see with humans with the chiropractic treatment with that. However, the amplitudes or the height of those are very practitioner treatment specific, because I can apply a very fast force with a low amplitude, or I can provide a very high force with a very high amplitude force over a longer period of time or a shorter period of time, just depending on my speed with that. And we see that a lot of times with students that we're training, is that the speed is oftentimes the things that the students lack. We can teach them how to apply the amplitude with that, but oftentimes the speed is more of a psychomotor skill that they need to do with that. And so that's sometimes more of a challenging technique to teach them to do that. In general, because of horses are bigger, larger mass, and larger inertia with that, then we do have to apply more force from those. And so some of our peak forces can be higher than people. If we applied those same forces in humans, we would probably hurt people. So there is, definite physicality to that as far as the practitioners that do that. But oftentimes, if you're using increased speed or being very fast with that, then we can have smaller sized chiropractors, animal chiropractors treating very big horses to be able to do that. Great.
So you mentioned, we've mentioned a couple times now about the possibility of combining various kinds of treatment. Mm-hmm. And in theme 4, you have done some clinical trials, one in particular we're going to talk about now. And this is in horses with acute versus chronic back pain. And in this study, you coupled laser therapy and chiropractic care on back pain in quarter horses. And I just want to say, this makes me think of when I bought my first laser to use on humans. I actually read a study very similar in humans from South Africa, the authors were, and they coupled laser therapy plus chiropractic adjustments for neck pain. And what they found was a greater effect when they used both together. So I read that, and then I went out and bought a laser. Okay. But anyways, so in this study, can you tell us exactly what you did and what you found?
Sure. Yeah. Well, I did read a paper on laser therapy treatment in horses and went out and bought a laser. I guess my experience is that I was trying to do chiropractic evaluation on some of these horses that had really acute back pain, and they wouldn't let me touch them or let me put in acupuncture needles. So it's like, well, if I'm called out to do chiropractic on a horse and I can't even touch them, then how am I going to do chiropractic? And so with that, then I was introduced to laser therapy, and a lot of these horses, after treating them with laser therapy for 5-10 minutes, then I was able to at least mobilize them a little bit or put a few acupuncture needles in there to kind of help break that pain cycle. So that's kind of my story or introduction to laser therapy. And then, similar to what we had as far as understanding which one of these therapies is better, if we have a horse that has acute back pain, should I be doing laser therapy on this horse, or should I be doing chiropractic care, or should I be doing mobilization or massage? And so with this study here is that we wanted to really compare the laser therapy, which in my hands seems to be much more effective for acute pain, muscle pain, myofascial pain, versus chiropractic in my hands seems to be much more effective for chronic back pain or stiffness type of issues. So really wanted to compare those two therapies in this population here. And so, and these were all horses that were actively competing natural occurring back pain. And if you're not familiar with some of the competitions with the horses, sometimes they're ridden pretty hard. Sometimes they have several competitions during the day. Sometimes their training goes on long into the night, trying to get them fit or ready to go for their competition. So these horses tend to be pretty sore in certain areas, or can even become lame if they're not accustomed to that high level of focused or intense type of treatment with that. So we looked at those horses, and these horses were enrolled if they had back pain or stiffness. And then we divided them into either a low-level laser therapy group, a chiropractic treatment group, or we did a combination of both of those. And then we applied a series of 3 treatments over 3 to 7 days, which would kind of mimic what a typical clinical setting would be for humans that have acute back pain. You usually see them more frequently over a shorter period of time, and we do that similarly with horses there. In this study, we really wanted to pull out all the stops as far as how to objectively or subjectively evaluate these horses in a clinical performance setting. And so we kind of grouped our outcome parameters into kind of more nociceptive or pain effects. And then we also looked at some functional effects as far as related to spinal reflexes or carrot stretches, things, can you bend your back better, or can you reach down to this area here? We also used visual analog scales. The owners would report or scale their horses or score their horses' back pain, and then the veterinary examiner would also do that to compare, what's the perception from owners as far as their horses with back pain versus the veterinarian with back pain. And our findings were that owners really tend to underestimate back pain. Some owners don't realize that their horses have back pain. And so I think that that's a pretty important take-home message, is that we need to have more people out there examining horses to educate owners about back pain and how to assess that. Most of the time they don't really understand that unless they're getting bucked off the horse. Then it's like, okay, well, there must be a problem here. But these horses were obviously in active competition and not bucking, but they were still having some significant pain there. So other kind of more routine spinal exam things we were looking for was back pain, muscle hypertonicity, and stiffness to do that. And we also did pressure algometry to measure objectively nociceptive thresholds here. So the results then, as we found that the laser therapy with the protocols on the wavelength and the treatment time that we did in this study did produce significant reductions in back pain. Also caused some muscle relaxation and improved trunk stiffness or flexibility, or improved trunk flexibility or reduced stiffness. So seemed to have significant effects in this population of horses. The combined therapy had similar effects with that. And also did have a little bit of effect on reducing the severity of the muscle spasms and the stiffness there with that. Chiropractic treatment by itself did not produce any significant changes in the back pain or the muscle stiffness or the muscle hypertonicity or the trunk stiffness. However, it did have more functional effects from some of the spinal reflexes where we asked them to do belly lifts or other kind of what we call buttocks or pelvic flexion, lumbosacral flexion tests. So interestingly, didn't have any nociceptive effects, but had more kind of what we consider tests of core stability in that area. So interesting effects there with that. And I think the bottom line would be is that I would, after the study here, apply laser therapy or combined laser therapy with maybe more spinal mobilization, more soft tissue techniques until we got them out of that acute pain. And then I would step in probably with more aggressive stretching or chiropractic treatment at that time.
Very good. I like that order of operations that's informed by research. Very nice.
Yeah, well, and I think that that's what we've seen clinically too, is that we have some of these horses that have severe neck pain or what we call hyperalgesia. They just have severe windup all over in their body, central sensitization type of things. And so we always start off with maybe non-steroidals if it's acute back pain, but then we resort to acupuncture, chiropractic, stretching. If things aren't helping there, then we're going to step up and probably do a little bit of shockwave therapy, help out with that. And if those things aren't working, then we're going to step up and do corticosteroid injections, intra-articular, to help out that way. So we do have a progression of treatment modalities that we use. Clinically, we just don't have good research to support that, to say which one we should use at one stage or another. And I guess, that's where we need to head in the future as far as understanding when to use these and how to use these in combination or not.
Great. Well, I want to probe your mind a little bit further about when someone should have their horse looked at as far as for chiropractic care in particular. I know just like with humans, some chiropractors get assessed and treated without symptoms. Others do have signs and symptoms. I'm just curious what your thoughts are for when horses might need chiropractic care. Do they need to have symptoms or not? Obviously, we're getting results, or you're getting results when there's no symptoms. So just curious, because in the human world, it's a big question. When should someone go to a chiropractor? Yeah.
Well, I guess, there's kind of the more flippant response, as far as, from D.D. Palmer or V.J. Palmer's, if you have a vertebrae or vertebral column, then you need chiropractic care. And okay, I understand that. And that's probably part of that too. But I don't think chiropractic is the end all for all spinal issues or, performance issues that you might have. But I've treated horses both ways. I've treated horses clinically that come in with severe signs of back pain that the owners say, well, he's bucking me off, or he's not doing his job, or he can't jump like he did, or he can't bend that barrel like he did before. And so there's obviously clinical complaints, chief complaints, why the owner come in. And then we can treat those. Most of the time we diagnose those. We really understand, is this more of an articular issue? Is this more of a soft tissue, muscle myofascial issue? Or is this more of a neurologic component to that? So I'm a strong believer in our treatment is only as good as our diagnosis. And so in those cases that do present with obvious clinical signs, then we need to pursue our diagnosis as best as we can to figure out, is that due to impinged spinous processes in the back, or is it due to more of a muscle metabolism deficiency or glycogen storage disease? Because there's lots of myopathies that are out there that horses present with back pain to do that. And so those are things, again, that we need to think about from that area to do that. And then the other side, or the flip side, is as far as the preventative or the maintenance type of chiropractic care. And I do routinely see horses on a periodic basis, sometimes, every other week or once a month or every 6 months. We just go out and evaluate those horses and treat them as I see needed, from a stiffness or a pain perspective, or a myofascial, hypertonicity perspective, even though the owner may not have specific complaints at that time. And I think that it's important for all animals to have evaluation and then periodic treatments with that, especially for horses, because we're usually ridden, have some rider on their back. And if you're competing, I think there's good evidence from the human side that any of our elite human athletes need some sort of preventative care for them to do their job, or some sort of cross training and things like that. And our equine athletes are superior at times to some of our human athlete endeavors for amount of distance that they run, or the height that they run, or the speeds that they run, that they need all the care that they can get to. And if that's chiropractic care, or if that's proper fitting saddle, or proper hoof care, or proper nutrition, I think all of those are very important for maintaining that athletic ability, or even helping some of those geriatric animals that have chronic arthritis, chronic stiffness, and pain. They have that. It's not ever going to get better, but we need to provide some care for quality of life issues. And I think chiropractic is one of those tools that we can definitely step in and help out with quality of life issues in some of those geriatric patients too.
Great. Really, really enjoyed that answer. Thank you. A goal of this podcast series is to motivate and assist practitioners and students alike to pursue research careers in chiropractic science. And in this case, it could be human or animal. Could you give us any advice to aspiring chiropractors or vets or students who wish to become scientists?
Yeah, well, I guess different people have different motivations for going into research. Some of those might be personal reasons. Maybe you had somebody in your family that, died of cancer, or had a chronic medical, disease or disorder. And, you have a strong tie to not see anybody else suffer that. And so that would be your motivation to get into research, to understand or help treat some of those chronic, unremitting type of diseases, to do that. Other people, kind of like myself, are lifelong learners. I just want to keep learning and learning. If I'm not learning, I feel like I'm stagnating or kind of falling behind here. So I'm always interested in whatever is new and exciting out there, or trying to create ways, again, maybe to better objectively measure things, or come up with better treatment protocols, or figuring out for this individual patient, this is the standard of care that we should be providing here. So different people have different motivations to do that. I guess the challenge I see with that oftentimes is opportunity. Some people, because of their training or qualifications, may not be able to meet the requirements to get into some of those programs. The other thing is, oftentimes I find very, very frustrating, is just the lack of funding to pursue, those things that you would like to test or like to do with that. So I guess the bottom line would be is, if you want to make a difference in people or animals' lives, then research is the only place where you can really objectively do that, to see, what it works, what doesn't work, what is true, what's repeatable, to do that, what's clinically effective, to help push new frontiers and push the boundaries of knowledge to improve health and wellness in animals and in human lives. If that's a calling that you want to do, then obviously research is the only place that's really going to help you to be able to meet those goals or aspirations that you might have.
Oh, thank you so much. And Dr. Haussler, it's been a great privilege to be able to interview you today. I've learned a lot. I know people that are going to be listening will learn a lot as well. And there's some of those points. I think I'm going to have to listen to this several times to really grasp everything. But thank you so much for coming on.
You're welcome. Very much to be here, and thank you for the offer to contribute and share a little bit of information today. Appreciate that.
Great. Thanks for listening to this episode of Chiropractic Science with my guest, Dr. Kevin Haussler. Please stay tuned for more great episodes coming up.